I learned that even though this job was very different than what I wanted to do long term, I learned a lot of skills that I actually use in my job now. So it's kind of going off of the philosophy that no time is wasted, that all the skills that I learned there I've applied to my job now. I actually interact a lot with the women that come into our program are going through like immigration things, legal things. And so even though I don't work directly on the legal side, I understand and empathize with them because I worked on the other side of preparing people's cases, having to look at every single detail because if one thing was off, their whole case could be dismissed. It's a very high stakes, I think, job. And as I worked my way, it got a little bit more stressful, but I learned a lot. And so that's why sometimes people are like, oh, I'm doing something and it's not really aligned with where I see myself long term. Sometimes it's like, well, what can you learn right now? How can you show up and be your best self? So when you get to that position of that dream job or where you want to be, you can know that you learned at every single step of your career.
Welcome to Public Health Careers. I'm your host, Omari Richards, founder of the Public Health Millennial. We're going to dive deep into public health topics and career journeys. You'll hear diverse career stories, absorb professional development and career strategies, get tips, while also learning from others to help you in your own journey and learning of public health. Learn about the vast world of public health careers, or just hear public health stories. Stay tuned so we can do our part towards a culture of health, well-being, and equity for all. Hey friends, welcome to Public Health Careers. Today I interviewed the dynamic Fernanda Ortega. Fernanda is a program manager for Bridges to Mom at Brigham and Women's Hospital. She's passionate about bringing people together and developing programs that support community excellence. She conferred a bachelor's in biomedical science at Toronto Metropolitan University and then got her Master of Public Health in Healthcare Management at Boston University School of Public Health. Fernanda is a first-generation Latina immigrant with Nicaraguan roots who grew up most of her life in Canada before coming to the US for her Master's of Public Health and continuing her career here. In today's episode, you'll hear and learn more about how she highlights the important role that social determinants of health play in real-world experiences with her work with Bridges to Mom at Brigham and Women's Hospital. You'll hear her share about the importance of cultural competence, sensitivity, and inclusivity, why she decided to pursue a Master of Public Health in the US when she got her Bachelor's from Canada, as well as the importance of networking to create opportunities in your public health career. Before we get to this show, I know that the American Public Health Association conference in Atlanta is next week. I will be there. I'm hoping that many of you all will also be there. If you're going to be there, please be sure to look out for me. I would love to take a picture with you all, to chat and to just get to know you all a lot better. So be sure to look out for me or reach out to me and we can meet up at some point in time. Okay, now enjoy the episode.
Hey, this is Fernanda Ortega. I'm a program manager at Brigham and Women's Hospital, and you're listening to Public Health Careers.
Welcome to the show, Fernanda. It's a pleasure to have you on today.
Thank you. I'm so excited to be here.
Likewise. And as I've said before, I hope that the process of getting you on has been seamless and the least stressful on your side.
Oh, for sure. I'm excited to be here.
Awesome. So just jumping into things, like how do you identify and tell us a little bit about your personal background?
Yeah, so I'm identified as Nicaraguan Canadian. So I was born in Nicaragua. Both my parents are from there. We emigrated to Canada when I was really young. So we ended up in Toronto. So I have some family there, but a lot of my family is still in Nicaragua as well. And so I grew up there. I love Toronto, amazing city, super diverse, multicultural. I love it so much. But I moved to Boston about just over 2 years ago to start grad school. So I got my MPH at BU, focusing on healthcare management. And I finished that up in January of this year. I've been working full time since then. And yeah, I love my big Latin family. Latin culture, Latin music, and dancing is something that is ingrained in who I am. So I love it so much.
Awesome. I look forward to hearing more about your insights on switching across the US to get your master's degree during the pandemic, as well as like what that has looked like for you after graduation and getting into the workforce. So I think that will be insightful for a lot of people that are listening.
Mm-hmm.
As well as I'm thinking of going to Nicaragua in next month actually. So
Wow.
that's yeah, it's kind of dope to hear that you are from there.
Yeah, that's so cool. It's beautiful. If you need any recommendations, let me know. It's been a while since I've been back, but I love it. I have family there. It's beautiful.
And which part of Nicaragua is your family from?
We're from it's a town called Masaya, so it's maybe like a 30-40 minute drive from the capital city of Managua. It's pretty small, but it's my mom grew up in Granada, which is also like a very touristy place. But they're both great cities.
Yeah, and those are well, Managua is where I'm thinking of going, as well as potentially Grenada as well. So that's awesome. So I will definitely follow back up with you after this to maybe get some recommendations and things like that.
Yeah, that'd be so fun.
Yeah, and like just following on that track, like your personal background as a Latino and as a first generation immigrant shapes your approach to public health and healthcare. How do you ensure that your initiatives consider cultural sensitivity and inclusivity?
Yeah, that's a really good question. I think I'm always kind of learning new things about my identity as a Latina and a first generation immigrant. I think there's a lot of unique experiences that immigrants face that you don't really realize, like as a child, like now being older and kind of reflecting on just think the way that I grew up and things that were normal to me that necessarily weren't other people's experiences. My parents didn't speak English when we moved to Canada, and so there's a whole other layer in that that a lot of now people that I know that are immigrants have faced. I think in healthcare, because it's such a complex thing. Obviously, I grew up in Canada where the healthcare system is very different than the US, but I think a lot of the situations can be similar where like if you're trying to navigate a system that's not in your language, how do you do that? So a lot of my time was spent helping my parents navigate that system, like helping them translate, explaining things while also being a kid and trying to navigate things on my own. So within healthcare, I think in terms of ensuring that initiatives are inclusive and that they're culturally sensitive, for me, the first thing has always been to be curious about the initiatives and the people that you're ultimately serving. I think sometimes in healthcare, we have an idea of what we should do, but trying to be curious about a person's culture, understanding where they're coming from, what shapes their perspective, how do they see life is very important. I am Latina, but within the Latin community, there's a lot of nuances. Obviously, I'm from Central America, which is different from a person who's from the Caribbean or from South America. So even when I have like my program, or just in general in life, when I'm trying to approach a situation, is coming from like a place of humility, cultural humility, trying to understand. And then there's always like small things that you can do. Sometimes the idea of being inclusive seems very daunting, but it is like my program. All our team is bilingual and are people that identify with the population that we're serving. I think that's very important for teams to have within healthcare and also making sure that your materials are translated into the languages of the people that you're serving, which seems very like intuitive, but when you're in these spaces, sometimes you realize that it's not a priority. So small things like that also make a really big difference.
Yeah, absolutely. And I think starting off with the curiosity is such a big point. And I made a video recently, or yeah, well, a video recently about my experience with Dr. Camara Jones, who is like a public health powerhouse who does a lot of like
Mm,
anti-racist stuff and stuff like that. And one of the things that I really took away from being around her was just her curiosity. Like, regardless of her doing all that she does know, she was just open to hearing what other people had to say and like being very enthusiastic about that. And I
yeah.
think that that is the case and how we should be thinking about things in healthcare, in public health, and like to your point of like just ensuring that we are taking a step back and looking at how is this saving the populations that we are trying to save, like how are we meeting them where they're at to give them information that they can really understand.
Yeah, and I think it also kind of brings people's guards down. Obviously, when people are in the healthcare system, it's a very vulnerable time. They have a lot of more, oftentimes more questions than they have answers. So approaching with questions instead of like, this is what you should do, I feel like people just kind of let their guard down and feel a bit more safe, which ultimately helps you help them better.
Yeah, it's always interesting to think about that because many times when people are coming into the healthcare setting, it is a time of stress for that
Yeah.
person or their family. So how can we meet them and make them as comfortable in those situations? So yeah,
Hmm.
appreciate that. So the social determinants of health play a pivotal role in public health and in healthcare disparities. Could you share a specific example of how you've addressed these determinants to improve patient outcomes?
Yeah. The program that I support, it's called Bridges to Moms. I think we'll get into that a little bit later, but the social determinants of health are very vast, and so there's so many different things. The program is called Bridges to Moms because our what we want to do is to bring like bridge gaps within healthcare, specifically social determinants. And so something that I'm doing with my team is oftentimes transportation is a very big barrier to healthcare. And it seems like a lot of people don't think about transportation as something that's very important, but a lot of the moms that we help are they're housing insecure. A lot of them are homeless, and so they're placed when our team helps them get placed in shelters. But because there's a big housing crisis in Boston right now, it's very hard for them to get placed within the city. So sometimes they'll be moved to shelters that are outside, like an hour, 2 hours, sometimes even 3 hours away from Boston. But all their care is being done in Boston. And so transportation is a huge barrier. And so our team has a contract with Lyft where we provide them transportation to and from all their medical appointments. And so I think that's something that people don't necessarily think as transportation affecting your health. But if you're not showing up to these appointments, especially a lot of these women have high risk pregnancies, or if they have a baby that's in the newborn ICU, they can't get to them all these times to be able to bond with their baby. And so that is one social determinants of health that oftentimes doesn't get the attention it deserves, but you need to be able to get to your appointment to be able to get the treatment that you need to stay healthy and to have this baby. And so our team is it's a lot, it takes a lot of work, obviously a lot of resources that goes into it, but we have seen um, the compliance rate like be really high because we're able to follow up with them and get them to their appointments.
Simple but important work that needs to be done, and as as you're saying that, because I know many times when I was in my master's of public health program, there were a lot of case studies around like compliance and like looking at the patient in the sense that, oh, they didn't show up to the appointment, I guess they don't care about this. But like, are you looking at all the factors that are leading up to them not being able to come? Are you providing the resources or trying to bridge the gap, as you're saying, to
Mhm.
get them to come, to ensure that they're compliant? And shout out to you all for doing that work. 3 hour drive, 2 hour drive is no joke for anyone, especially someone who is a mother, or going to be a mother. So
Yeah.
that's awesome that you're able to do that and to connect them and to bring them in to really ensure that their care is continued and there isn't gaps in their care. So shout out to your team.
Thank you.
You're most welcome.
Mhm.
So before we get more into your collegiate career, what does public health mean to you?
Yeah, I think that's a big question. I think public health is truly being able to empower people and giving them the tools and the support that they need to understand their health and to also take ownership of their health. Um, Public health is more, I think you see people as human beings, that they are not just like a one size fits all, they're very complex. Going back to the social determinants of health, there's just so many things that affect health. So I think public health really is being able to educate people to make the decisions that's best for themselves, to live healthier lives, not just for the individual, but eventually that will spread to their families and then their communities and then populations. So that's one of the reasons I went to public health, because there's a very big opportunity for impact, just with like changing one person's life, just changing a couple people's lives. The goal is to really make an impact and improve people's health long term.
I'm very curious to hear more about your decision to get your public health degree in the US, but we will get to that in a bit.
Yes.
You started your bachelor's, well, you got your bachelor's of biomedical sciences at Toronto Metropolitan University. Tell
Mhm.
us about that thought process going into it.
Yeah. So I, for the longest time, I thought I was going to go to be a physician. So that was since being like little, that was the only thing I would talk about. In Canada, you don't really refer to it as like pre med, which I think is really big in the US. But essentially, what I did was the equivalent of that. I chose to go to Toronto Metropolitan University because it was a smaller university. The Faculty of Science was a bit smaller, so classes were smaller. Um, and I really wanted to get that interaction with my professors and have a smaller class and kind of get to know my classmates better. So I decided on my biomedical sciences. It was a lot of like science and theory, which I loved science. I still do growing up. I was definitely a science nerd, and it was just so fun. I loved it. And school, the program that I was in was the cohort was pretty small. And as like as we moved on to in the years, it got smaller and smaller with like classes. So I got to know people pretty well. And I had a lot of opportunity to work on campus. And so if you're from Toronto, the Toronto Metropolitan University, along with a lot of schools that are in the city, are very popular for being commuter schools. So a lot of people come from different parts of like the greater Toronto area. And so I commuted like an hour each way for school. And so I knew I wanted an on campus job just because it would make my life easier. If I was already in between classes, I can go to work. And I worked a couple jobs on campus, but the one that I ended up staying for the majority of my undergrad was at the Science Outreach and Communications Office. I met that through like a connection with someone, and I loved it. It was great. I learned a lot about how do you communicate science to the public. A lot of scientists are smart, incredibly smart people, but sometimes they can't articulate properly, or that they're not taught how to articulate their amazing research to just the general public. So the office is very much how do you make science accessible to other people? How do you make programs available to people and like to kids in the cities that maybe don't have as much resources? So it was a lot of fun. I learned a lot, and I got to meet a lot of great people. Some of them are friends that I still have today.
That's very real. There are amazing people out there doing amazing research, but many times they speak way above everyone else's head.
Yeah.
So to talk to that point, what are some of the tips or some of the things that you learned in doing that job that people should think about when they're trying to communicate their research or just like any information to populations that mightn't be as highly educated or just versed on their specific topics?
Yeah. I think one of the things that we would consistently be drilled into was no jargon. So there's a bunch of like within every field, there's obviously terms that even within like working in a hospital now and setting so many acronyms that they're like no acronyms. Make sure you spell everything out. Don't use like huge words. Like if I have to pick up a dictionary or like Google it, then don't use it. Um, I think that was something that's big, and sometimes it's harder than you think because once you're in that world, these words just come out naturally. Um, so I think that would be a big one. And then the other one is also maybe trying to gauge the people that you're interacting with, how much they know. Obviously, different, like if you're in the general public, then you kind of assume that they're all on the same playing field. But asking them questions to kind of get an idea of how much they know or don't. Obviously, that's like when you're delivering a talk. But when you're writing things, social media is really big. A lot of like academics are on like Twitter, for example, or X now. I'm not fully on that, so I don't really know. Um, but it's like, what's your point? What do you want people to get across? And how can you say that in the least amount of words? Which is really hard, especially if you have like a huge paper that you dedicated years to doing. And how do you put that in like a few characters? But I think a lot of people do it with practice and they get really good. And I'm like, wow, I want to be like you. So I learned a lot from that.
I appreciate that. And yeah, that's actually something that I'm looking into doing myself, like just becoming more of an impactful writer. And like to your point of like, how do you take big topics? What are the key points? What are the bullet points under that key point that kind of make it make sense to people? And just deconstructing that to make it make sense for more people so that they can really take away the key takeaways from a lot of this great research and information that is out there that usually is very inaccessible.
Mhm. Yeah.
during undergrad, you were also an administrative assistant at Canada Immigration Consulting Limited. Tell us about that experience.
Yeah. So I actually did that right after undergrad.
Okay.
So I did that part-time. I think it was like a month after graduating. Um, I graduated in 2020. So in like the spring of 2020, I like vividly remember where I was when I was in COVID. I was in a lab meeting because I did my thesis, and they're like, well, it looks like the world is shutting down. And so I finished undergrad 2020, and I was looking for a part-time job. So I started as an administrative assistant at Canada Immigration Consulting, eventually working my way up to a full-time position and then like a legal assistant, which seems really odd because I did obviously biomedical science, very theory based, and then I went into a field that was completely different. Honestly, it was just I'm taking a gap year, trying to figure out what my next step is after undergrad, and I need to be making money. And so I applied for a couple of jobs and took this job. It was good. And obviously, it was during COVID, so there wasn't a whole lot of jobs to choose from. But I think it was honestly a really great experience. I learned that even though this job was very different than what I wanted to do long term, I learned a lot of skills that I actually use in my job now. So it's kind of going off of the philosophy that no time is wasted, that all the skills that I learned there I've applied to my job now. I actually interact a lot with a lot of the women that come into our program are going through like immigration things, legal things. And so even though I don't work directly on the legal side, I understand and empathize with them because I worked on the other side of preparing people's cases, having to look at every single detail because if one thing was off, their whole case could be dismissed. It's a very high stakes, I think, job. And as I worked my way, it got a little bit more stressful, but I learned a lot. And so that's why sometimes people are like, oh, I'm doing something and it's not really aligned with where I see myself long term. Sometimes it's like, well, what can you learn right now? How can you show up and be your best self? So when you get to that position of that dream job or where you want to be, you can know that you learned at every single step of your career.
And kind of taking it away from a deficit perspective and saying that every opportunity that you have is an opportunity to learn and build skills that you can take into the next position. And I think that's very real. And those transferable skills are so, so important. So taking you back to, I guess, before you graduated undergrad, were there any undergrad takeaways that you had that you wanted to share?
Yeah. I think during undergrad, I like getting it sounds very cheesy, but like getting involved in things outside of class, I think is very important. I like I mentioned, I worked on campus, and so within that, I was able to meet a lot of different people. Um, and I think that kind of started me becoming more curious about different jobs outside of what I wanted to do or what I had originally planned that I wanted to do, which was go to medical school. Undergrad was obviously very stressful. There's a lot of things competing for your time, and obviously, there's a life outside of school. So I think having other groups to get involved in that it's not strictly school. Like I was involved with a couple organizations, different things like volunteering, and it was just really like it made the experience a lot better than if I was just going to school and going home. So I would say it doesn't have to do everything. I know a lot of people thinking of going to medical school, it's like you have to do a million different things to be able to get into school. But I think picking things that you're passionate about, that really helped me to have a good like undergrad experience.
And it fills those buckets that you mightn't be filling from the schoolwork. And there's so much to learn and so much experiences to have that are not just in classes and outside of like that academic setting per se.
Yeah, for sure.
So you graduated, you said that you took a gap year, you wanted to get a job, you worked at Canada Immigration Consulting part-time into full-time. What was that thought process during that gap year for you? Was there anything more that you're trying to seek out or like learn about yourself?
Yeah. So I had been near the end of my like maybe the last 2 years, was kind of reevaluating if I really wanted to go to medical school. Kind of just thinking about if that's what I wanted, and I did a couple trips. I volunteered abroad, so I went on a trip in 2018, and then in 2019, the summer, I went to Central America on a medical and public health brigade. That was kind of my attempt of, okay, like, let's see if I actually want to do this, like, get more exposure. So I was away for a while, and my thought process going in was like, I'm going to know that I love the clinical aspect, the medical side. Like, that's why I wanted to go. The public health was like in addition to. But I got there and we were helping run clinics in rural communities in Honduras. And instead, I loved the doctors and they were teaching us about the different things. Like we would see them look at clients, see a couple procedures. But I found that what I was really just gravitated towards was like, how did you get a clinic from like the city to the middle of nowhere? How do you get all these supplies there? How do you get the doctors there? And because I speak Spanish and some of my team didn't, I was able to, like, it was just the language barrier wasn't there. So I was able to get pretty deep with the people that were coming. A lot of them were women and children. A lot of you had obviously patterns of diseases, like hypertension is really big, diabetes, HPV, just things that like just keep coming up. And so my brain, instead of like going on like, what are the diseases? I was like, but why is this happening? Or how can you make this? How can you fix this? And then that kind of planted the seed of public health. And so that was going into my senior year of undergrad. And it was a pretty big pivot for me because it kind of rocked my world because I was like, public health, like, what is this? I don't really know what this is. And so I actually wrote my MCAT that summer, right before going on the trip. So I was like, what do I do now? Do I apply to medical school? And then I was like, well, I'd probably take a gap year and just do more research, look into public health. And I think the more people I talk to and just asking people, and people would always give me feedback, or like, you seem really happy when you're talking about this or this aspect, you seem more passionate. And honestly, there's also an element of my faith. So I'm a Christian. And so my relationship with Jesus is really the center of what I do. And so tuning into my church community, a lot of prayer, a lot of figuring out, okay, what is the next step for me? And public health seemed like the next step. I didn't know where that would lead, which is oftentimes very terrifying, but I knew that that's what I wanted to do. And so I took a gap year. I worked on narrowing down what graduate schools I wanted to go to. And because I grew up in Toronto my whole life, I'm like, I love it, but I also want to experience something else. So, and I didn't want to go to Europe because it would be too far. I wanted my family to visit me. So, like, the US seemed like great. So I applied to schools in Canada, but also schools in the US, mostly keeping it to the Northeast. And BU was really good. It was really like highly ranked. Talked to a couple alumni, and I thought I wasn't going to get into any public health programs because I made my shift really quick. On paper, didn't really have a lot of public health experience, but it just goes to show if you're passionate about something and having a good personal statement and all of that, like if it's meant to be, it will be. So I got into all the schools that I applied to, and that made it even harder to make a decision. But ultimately, I chose BU. Moved here without having visited Boston before. But yeah, it's been really great. And I went off of a hunch, and I really love public health. I think it is a perfect fit for me.
Okay, a lot in there. Firstly, I think like Boston is probably the most similar city to Toronto in the US in a lot of different ways. So that was a good choice on you there. Um, but yeah, shout out to you for like taking the opportunity to go on those volunteer trips, and in doing so kind of realize that there was this other thing outside of like clinical medicine that was something that interested you, and from that just kind of dove deeper into learning and talking to people and
Yeah.
understanding more about like what you can do in this, and like how and why are these things like this, because many times I don't think we give ourselves the space to kind of understand that. So when did you learn about like the term or like the field of public health per se?
Yeah, so I didn't learn about it until late when I was doing research into that brigade because I wanted to volunteer work somewhere, which I think is probably a downfall. A lot of undergraduate programs, at least maybe where at the time that I was there, public health, this was pre-COVID. I feel like now things have changed and public health is better, like more well known. But when I didn't know anything really about public health as a career with what bachelor's I was doing, so I kind of fell into it. It was like medical slash public health. I went into it with a medical perspective, but it came out like really loving public health. Now when I talk to people that are younger than me, I'm like, you should consider public health. And sometimes that's just seen within like the COVID or infectious disease lens, but there is so much that you can do within public health. It's sometimes overwhelming how many things you can do. But I think in terms of education, I wasn't really well educated about the field early on in my career. I found it pretty late. So I'm also passionate about sharing what this is what public health is. And there's just so many different things that you can do because sometimes people like, oh, there's only like one or two things that I can go into, but there's just so many things. And you find out when you're out there, like a working professional, how people found their way to public health. It's oftentimes not super linear. But I think it's great because you get people with a lot of different expertise.
Yeah, expertise, experiences, and that is a lot of the times the path of a public health person. And one of the challenges of being in or getting into public health is that you learn about it later on, and then you realize there are just so many different things you can do. So how do you decide on what are the things that you do want to do in public health?
Mhm.
So all important things. And yeah, I'm glad that you're on today and you get to share your story and your path so that it can help and support someone else out there.
Yeah, and I think things like this or like your channel is also so helpful. Like I feel like I would have if I would have come across this when I was an undergrad, it would have been so helpful to know what's out there. So I think it's very very valuable.
Exactly why I created it, because I had no idea what public health was until I was scrambling looking for a master's program to get into and I
Yeah.
found public health, and then it's been it's been everything since then. So I
Mhm.
appreciate that. You got your master's of public health in the concentration of healthcare management at Boston University. You
Mhm.
shared that you applied to a lot of programs and you got into all the programs that you got into, and then you decided to choose Boston University. So why Boston University? And before you answer that, I just want to also highlight the point of you saying that you felt like you were also scrambling, not having much public health experience, but still you decided to apply and still you decided to write your personal statement. And in the experiences that you have had, it has allowed you to really show that, hey, this is something that I am passionate about. This is something that I want to learn more about and see how I can make this impact for the communities that I want to work with. So I
Mhm.
think that's important and something that should be highlighted for other people out there. Like it's okay to apply scared and not knowing everything or not knowing that you have like specific public health experience in your background, because you can always gain and learn that. But back to the question, why do you choose Boston University?
Yeah. I It's interesting. Like BU, obviously, it ranks really well in terms of public health. I think we're at like number 6. At the time when I applied, we're like number 8. So that has some aspect too. And I think when I was looking at public health schools, the ones in Canada were newer, whereas the ones in like the US had been out for a lot more years. Like BU, I think celebrated their like 150th um like year. And so I think in terms of I'm like I want to be in a place where it's an established program where I'm coming in, rather than being like the tester because my program an undergrad was one of the newer like I think we were maybe the 4th cohort, so it's pretty new and that was great. It was really positive, but I for my master's I wanted something that was already established and had a lot of connections, and I think strategically Boston there's just so much like to do with healthcare here. I work in like if you're from the area in the Longwood medical area, which you have major hospitals like you have Boston Children's, Brigham and Women's, um, yeah, like Beth Israel, and then you have MGH a little bit further away. So there's just it's a very big healthcare hub, and so I knew that I wanted to be positioned in a place, especially if I was coming from outside of the U.S. and for a place that had bigger names, so that if I wanted to go back to Canada, I also had that experience under my belt. So a lot of it was like strategically thinking, um, and I spoke to a lot of alumni at BU. I reached out and asked them to connect me with people. And I intentionally also asked them to connect me, the admissions people, with people that were from Canada that were either still working in the US or were now back in Canada working, because I was in a unique position and trying to get their perspective. Was it actually worth it to come to the US or should I stay in Canada? That was a whole other layer. But everyone that I talked to that went to BU spoke so highly of the program. There was like no person that said, obviously, the program's not perfect, but in overall, they loved it and they took a lot out of it, and felt very supported. And so I knew leaving my family for the first time, coming to a new city, I knew people that genuinely cared about me as a student, as a person, not just like as a number. So I think the turning point was definitely the people that I spoke to. They were amazing people doing amazing things, and they just really loved you.
Appreciate you lifting up those two key points there. The first one being like being strategic in thinking about the school that you want to go to and what are the opportunities that are surrounding this area and how can you position yourself to get into that. And I think that that's something that many of us don't think about enough. Like what are the connections or the geographical area where the school is and how can that support me in building my skill sets or just having more options for opportunities as well as taking it upon yourself to say, hey, admissions people, connect me with not only alumni, but alumni that are from Canada as well and that are working in the US to really get their perspective on it, because that is a whole different perspective than someone who has just been in the US or has lived in Boston their entire life and then has went to school there. So
Yeah.
like kudos for you for doing that.
Thank you. And I think it's also, you oftentimes think you're the only person in this position, but like just asking, like, is there someone else that has gone through something similar or is walking into like has already gone through something that I'm walking into? You really realize that there's a lot of people that you can reach out to, and they just speak into whatever it is. They have the same problems that you're having, or can it really be a sounding board. So oftentimes you think you're alone, but there's someone out there that can help.
That is very very true, and I think other people should take that and understand that and see where you can reach out to people who have had similar experiences, similar paths, and just like to your point, like get that sounding board, ask them those kind of questions that you know that you have, and from their perspective, that they would be able to share things that are insightful to you. You got your master's of public health in the concentration of healthcare management. Why do
Mhm.
you choose healthcare management?
Yeah. I originally, when I applied for BU, the way that the program works is that you have your like, I think, functional certificate, which is like your major, and then your context certificate. I might be mixing them up, but like you have essentially like a major and a minor. And so when I applied for the global health because I went on this grade and I loved public health and I loved global health. How do you look at implementing programs around the world? And so, but I wasn't really sure about that. And when I came, we had a grace period to figure out what you wanted to like focus on. And healthcare management kind of piqued my interest. So I met with the director of that, the healthcare management program, and I was like, "What is this? Like, it seems interesting, but I don't really know what it is." And he was really great, and he actually ended up being my advisor all throughout grad school, and he is amazing. So he walked me through what it was, and I had done a lot of administration and management in like my gap year at like the immigration firm, and I got a lot of positive feedback even before in jobs that I had held. A lot of feedback on like my administrative organization, time management skills. So it feels that felt like the perfect mix between things I was already good at and like healthcare and things that I was passionate about. So it was honestly like a gut feeling. I was like, this seems like it could be interesting. And the classes that we're doing, like operations or like healthcare strategy, things that I'm more passionate about versus when I was looking at global health. And so I made the change, I think like a month or two into grad school, and it was really great. I didn't really overthink it much. I just was like, this seems interesting. I think I would like it, and I went for it. And it was really great. There was a lot of hands-on when I spoke to the program director, a lot of hands-on projects and the ability to work with live sponsors and try to solve a problem that they were actually having, which I think was the main thing for me because if I was like, I'm going straight into the workforce after, I need to know what I'm doing. And so that was a selling point as well.
Yeah, insightful. And like once again, you're out here just like advocating for yourself in the way that you're asking questions to people to really see like, is this what I want to do? And how is this going to like tangibly support me in getting to where I want to be, whether that's like just generally getting into the workforce and being a successful public healthcare employee.
Yeah.
So I think that that's very important because too many of us kind of just let it go by without being proactive in our own journey and like just really making sure like, is this the thing that we want to do? As well as shout out to BU for being able to have that grace period in choosing. I think that is awesome because so many people get tied into a box of what they're doing before they even know like what public health really is or what they can do in it by choosing a concentration. And that's an issue that we're not going to change in this
Yeah.
conversation, but I think having that flexibility is really really awesome.
Yeah, and I know a lot of people that were on the same boat. They're like, "I think I wanna do this, but I don't really know." And so, you just have time to think and kind of be in the space and then make a decision, which is really good.
Yeah. So I'm gonna couple a couple of the experiences that you had during your master's program and ask you about them, and then I'll do another batch of those because you had quite a few experiences
Yeah.
doing your master's program. So you were an MPH operations consultant at Mount Sinai Health System.
Mhm.
You were administrative assistant at Boston University School of Public Health, and you were an MPH strategy consultant at Massachusetts General Hospital. Tell us about those experiences.
Yeah. So I'll kind of group them. So the MPH consultant positions, both at Mount Sinai and at MGH, those are part of like classwork that we did. And so those are kind of going back to what I mentioned before, like the live projects that we did. We actually worked with a project sponsor. And so for the operations project, we worked with the simulation center at Mount Sinai. And we met weekly with the director of education there. That was really great because we actually had a problem. This is something that we're actually having issues with. We're opening a new location. How do we figure out the supply chain management, the inventory? It's just very logistics based. And it's interesting. I sent him an email a couple months ago and was like, hey, like, I'm just curious to know if our project and our presentation and recommendations went anywhere. He's like, no, like it was so helpful. They actually opened the center and they're looking to hire people into the positions that we had recommended them to open. And so that was really cool. And then at MGH, I worked in the pediatric department, also looking at like staffing shortages, which was really big, which is still really big now, even like post COVID and like burnout and all of that. So that was helpful as a lot of group work. So learning how to work in a team. And then my position as an administrative assistant, I did that for like a year. Um, I wanted to be able to work during grad school. Obviously, living in Boston's expensive and paying for school, and so I wanted to be able to work. And because of my like visa and not being a U.S. citizen, I needed to work within like the school. And I was very fortunate to get a position in the environmental health department, which also is not what I was interested in, but I met a lot of great people, learned a lot about what amazing things that they're doing there. And a lot of that was like finance heavy, looking at budgets, looking at different grants, which are things that I'm actually looking into now at work. So I did that for a year while also doing grad school.
No one experience defines you, and you're always able to learn and use those experiences or different things from those experiences to build into what you're doing right now.
Yeah.
And it also sounds really interesting for you to say that when you went to volunteer in Honduras, you were asking a lot of the questions of like, how did you all, or why did you all set up this clinic in this place, and like how did you all do all those types of things, and then to be in your master's of public health program and have that's similar conversation around, okay, we're setting up a new hospital, what are the supply chain things that we need, what are these different things that we need, so just like piquing that curiosity and like building on that, so I think that that's awesome to kind of just hear that theme.
Yeah. That's why I'm like asking questions. It's very underrated. And so I'm like, you just ask. you don't lose anything. And sometimes people are like, I'm so scared they're going to think I'm not smart enough or I don't know. But I just feel like people respect when you're able to be like, I don't know, can you help me? Or why do you do this? So I think it's a good skill to have and something that I haven't always been comfortable doing, but I'm like, what can I lose? I want to learn at the end of the day.
Yep, it hurts you in no ways to ask the question. The worst thing that's going to happen is you're going to be in the exact same position you were before you asked the question, and
Yeah.
then best case scenario, you get more information, you understand something better, you understand why they do it this way. So, yeah, it's a no brainer, and it is definitely something that more people should definitely try to do.
Yeah, for sure.
So you were also a teaching assistant part-time at Boston University, and then you had a few different roles at Brigham and Women's Hospital, and those roles were program management intern, project coordinator, and program coordinator. Can you tell us about those experiences?
Yeah. So at the Brigham, well, yeah, at the Brigham, I part of the MPH program, which I think is pretty standard across all MPH programs. You have to complete. Some people call it internship, some people call it practicum. And so I applied to complete my practicum. I think probably like the winter before, or like the spring before. I need to do it in the summer. And I applied to a bunch of different ones, but I knew that the one I wanted was the pediatric newborn medicine position at Brigham and Women's Hospital. I've searched up a couple other ones. I It was kind of a gamble because it's hard when you're doing like applying for jobs or applying for internships, like the timing can not always work out. So I had to say no to a couple ones because I really wanted this one, but I wasn't sure if that's the one I was going to get. But through networking, I felt pretty confident because I had met the hiring person before. And so I got into I got the internship. So I worked as a program management intern. I had a couple of projects that they had lined up for me working on like the communication side of the department, helping out with a couple of research projects, like the operations. So I did that the summer that I was hired on, and then they asked me to stay in a like per diem capacity as a project coordinator. So I did that as I finished up my final semester of grad school. I learned a lot about just the being in a large academic medical center, all the different stakeholders that are involved, what it takes to kind of see a program and to evaluate it. And then, so I did program project coordinator, and then through that, I ended up being connected with my full time job. So when I graduated in January, through one of my colleagues was like, there's this program that the department closely works with called Bridges to Moms that's housed within the Division of Women's Health in the Department of Medicine. And it so happens that they're looking for a bilingual program coordinator. And so that's how I was connected to the program that I'm in now. And then I also work part time TAing one class for like healthcare finance when I was working. I think that was earlier this year. So that was like a remote job. And my healthcare finance professor was really great. So I just TA'd a semester for him.
And what was the experience like moving from Canada to come to the US? Was that a difficult transition for you?
I think so. I think it took me a little bit longer to adapt than I thought it was going to take. Because I went to school downtown Toronto, so the city life, I think, like, I had it down, and Boston is also, like, pretty city. I think, obviously, those feelings of homesickness, and then just missing family, I'm really close to my family, that was hard. I think moving to Boston, it was very unique because I was coming in to a place where no one in my family had really gone in their masters before, so no one really understood. And none of my friends had been in a master's degree back home, or people that I was really close with. And so it felt a bit like no one really understood what I was going through. And being in Boston, there's like so much opportunity. And being in grad school, you have this function that you can go to, this networking event. Everything's kind of thrown at you. So it felt very overwhelming being like a first generation like student as well, getting my master's, because I didn't really know where I fit in. And there's also an aspect of didn't realize how fortunate I was to grow up in a very multicultural place in as Toronto was. Like growing up my whole life, I was never the only person of color. Like there's always multiple people that were from different parts of the world, and I don't think I realized how much that impacted me until moving to Boston. Because I was in, obviously, as you move up in academia, it gets like less people of color. And so it was hard for me to find my place. I think it was like a lot of imposter syndrome. I think at like age 23, I experienced for the first time what it was like to walk into a place and be the only person of color. And I'm like, whoa, this is what people talk about, but this is actually what I'm experiencing now. So I think in that aspect it was hard, and I eventually found my people and realizing that I can have friends in different areas, like finding a group of like for me it was critical to know other Latinas that were in like getting their masters, because there's just certain things that some of my other friends can't relate to. So it was hard in that aspect. I feel like now I'm more confident in that, and I see it more as a privilege to be able to take my experiences with me. But it was definitely hard at the beginning.
And what sorts of advice would you give to someone that is a first generation person that is going into graduate school, and maybe even more so specifically graduate school in a different country?
Yeah. I think knowing that you don't have to do it all alone is very important. Sometimes being like an immigrant and just the way that you grew up kind of figuring things out on your own, you think that that's like the way that it always has to be. But being able to really tune into the resources that are available to you, and if there aren't any, to ask if they can help you. Um, I think that was really critical for me, and goes back to like meeting other people that maybe are not from the same cultural background, but talking to people that have gone through the same thing. I've learned so much. When I moved to Boston, I was very intentional with building my network here because I knew no one. And so I met with a couple people that led me to meet with other people. I met with so many people on Zoom for like 30-minute coffee chats. And there's one person that I met. He was like very high up in leadership at Dana Farber, and he was a person of color. And I remember he said something very interesting. He said that as like a minority, as a person of color, sometimes you see a lot of barriers, but you don't realize that you've been learning how to think strategically your entire life. You have been taught how to think 5 years down the road out of necessity, out of a lot of hard things. So instead of seeing that as a barrier, it is now seeing it as how can I use that now in my job to think strategically, to use those experiences. So meet with people that even if you think they won't get back to you, if you see a person that you admire that has walked through your shoes, that even that you can learn from, just reach out, because they will give you those things have really impacted me and have really like built up my confidence. Um, Knowing that I am a first generation student, I am a person of color, my family doesn't come from like it's like working class. Um, but those conversations have really given me the confidence to walk in that.
Love that. Appreciate that, and that's great insights for anyone that is going through that path. And like, reach out to Fernanda as well. She'll be able. She's happy to chat and see how she can support you in your journey as well. But I think like that reframing, as that person high up in Dana Farber said, that reframing of the barriers and the challenges that you face just being a person as you are, and how can you use that to your advantage in the work that you're doing is important. You also moved to the US during the pandemic and did your master's program during the pandemic. What was that like for you?
Yeah. I'm trying to think back at what it was like. Um, I think at the time BU had like the mass policy, but all classes were in person. So that also made it like I was more comfortable moving because I actually want the experience, and I was thankful for that year off because if I had to do the first year online, I don't think I would have gotten the full experience of like my master's. So I moved, and it was all mask. Honestly, it didn't really feel that different. I think when I finished my undergrad, I did like a month of online school, but I wasn't in the thick of it because I took that time off. So it didn't impact it as much. I think in terms of the content, we talked a lot about COVID. Um, our class going into like the cohort that I started with was apparently one of like the largest one in BU's history, like public health. A lot of people came in. They were like, we're going to go into public health. So it was a pretty big class. But I don't think, in terms of logistics and all of that, my experience was super impacted by COVID. We had a lot of things like to test all the time, like test weekly. But I think because I was in person still, I had a really good experience.
And were there any other MPH takeaways that you wanted to share?
Um, I think a lot of what I like mentioned, just networking seems like such a daunting thing. Like when you're said networking, people are like, "Oh, I need to walk into this space and make friends with a bunch of different people and sell myself." And I'm an introvert, so that sounds very daunting to me. So networking for the longest time felt really hard. But when you come into it with a perspective of ask questions, talk with people, ask them to talk about their work with like even in the classroom, like asking professors or asking a professor, "Hey, I'm looking for more of someone who does this or works in this place. Can you connect me?" I think that was one of the biggest takeaways and something that I really saw the growth throughout my MPH of being able to connect with people, meeting really awesome people that are doing great things, and also learning from them. You can learn, doesn't have to strictly be in a classroom. It can be in group projects. These are people that you will be connected to for forever. Maybe you'll make a connection down the line. So it is definitely just get to know people. And my MPH really taught me the importance of connections.
Very, very important. And especially when you're a student, like use everything that you have to meet everyone that you have and ask all those questions and ask for all those connections because no one is going to really turn down a student. They might
Yeah.
turn down a professional more, so, but still, when you're a professional, do the same things. But definitely as a student, especially if you're trying to learn and build that network, make those connections and get uncomfortable doing it. And in doing so, you'll become more comfortable as you do it.
Yeah. I agree 100%.
Awesome. So you're currently a program manager at Brigham and Women's Hospital. You spoke a little bit about while you were in your MPH program that you were the intern, then the project coordinator, then the program coordinator, and you spoke to the fact that you were using networking and that you met the hiring manager, which I think is part of all a good part of networking is like how do you just like know people and then it just happens that you are like, oh, they're in a space that I might want to work in,
Yeah.
and then continuing to make those connections. So how did you exactly come into the program manager role, and then what do you do as a program manager?
So I started as like the program coordinator at like Bridges to Moms. And so I was very intentional with my program director from the beginning. And I like pretty much told her my goal is to become program manager. I don't want to stay as a program coordinator. So she knew from the very beginning, which I would recommend just expressing your intention with like career growth and also seeing how that person will receive that. Because if they're like, no, like if you get any hint of like maybe they're hesitant, and if that's something that you want, maybe that's not the good fit. But I'm very blessed that my program director is very invested in my career as well. She's like, my career is built. I want to help you build yours. And so at the beginning, it was getting used to the program, knowing the team, figuring out team dynamics because when you come into a team, someone is added, there's always a shift, kind of figuring out where you stand in that. The program was completely new to me. It is within the Brigham, but we have a smaller team. So how does that operate? Getting to know the women that we help. And I also really wanted to be intentional with understanding the stories of the women that we support. And so my program director would take me on home visits. I would go to her with clinic to get to know these women Um, and so the project coordinator was kind of getting used to the program, the day-to-day operations, making sure we're tracking or like the resources that we're giving away. How do we track our cases and all of that? And slowly that led into program manager, where I help more in a leadership role now with my team. Certain aspects of, because I work with community health workers, so I don't work with the woman per se one on one. Sometimes I will make calls and see how I can support them, but it's mostly like the management side. So I'll keep up with the teams to make sure that certain tasks are done, that we're reporting different things like documentation. I help with like data things, and like more now shifted to more finances. And also I get a good amount of like strategy. So how do you keep the program sustainable? Right now we're funded a lot by philanthropy, but obviously how do we make it more ingrained within the hospital system? How do we bill for things in code, like different codes for services? And so that's like long term what we're looking into. So a lot of it is programs with like collaborating with different programs in the hospital as well. So we're still connected to pediatrics, which is where I started off in meeting with. There's so many, like when you're in such a big healthcare systems, there's so many departments, so many people. And it's like, how do you share what the program is? How do you build that connection and be like, how can we help one another? So that's like my work in a nutshell.
Yeah, I appreciate that. And like encapsulating all of that, being like leading and supporting the work of the Bridges to Mom program, what is the program's objective and the impact that it aims to achieve?
Yeah. So the program was founded in 2016 by Dr. Rosanna Means. So she's an expert in women's health and also in homeless health. She was approached a couple years ago by the hospital leadership because they were noticing that a lot of women would come through obstetrics and they would either share with their doctor or with their social worker or someone else within the healthcare system that they didn't have a place to take their baby back to, after they'd given birth, or they didn't have enough food to eat, or just a lot of like we talked about the social determinants of health, a lot of gaps within that. And so she established Bridges to Moms. The framework is that we have community health workers that will support the women that come into our program all throughout their pregnancy until their baby is a year old. So community health workers having intense case management. A lot of them spend time helping them get connected to government services like WIC or SNAP to get food stamps. They help them a lot with finding secure housing, so doing emergency shelter applications. A lot of the women, or the majority of the women, are women of color. A lot of them are Spanish speaking or they don't speak English. We get a lot of Haitian Creole patients as well. And so there's that whole other aspect of navigating such a complex system. Some of the women have faced like very violent situations. Some of them are fleeing like intimate partner violence. Some have have come to this country and so they're trying to get their like paperwork done. And so it's very intense and emotional work. But since 2016, the team has helped about I think over 600 women, and there has been like no maternal deaths, which is pretty huge if you know the really sad amount of like maternal death, especially among women of color. And so we're always looking to see how the impact of this program, where it's like there have been no maternal death, babies have better outcomes. If a baby is in the NICU, we're able to get the mom to bond with the baby, and so that baby will have better outcomes long term. And so it is looking at the woman's whole health and knowing that if she's healthy, if she's feeling fulfilled, then also that impacts the baby. And within that, we help connecting to mental health, which is big with like postpartum depression, and also connecting them to career opportunities to really change the trajectory of the mom and also the trajectory of the baby.
And you're speaking about all the intersections of all the things that make people whole and healthy. And this is what we need to get to as a society, is like, how do we provide all those supports for all those different needs, and understanding that people's lives and their health are complex and
Yeah.
very interrelated. So we need to think about all these different factors when we are thinking about people. So shout out to you all and the work that you all are doing. That is very phenomenal.
Thank you. The women are great. We support them, but I've learned so much from them. They're some of the strongest people I have met, and I'm just inspired by them too.
What do you like most about your role as program manager?
I like my role, I guess I can only speak to my role, but I think it's unique because I do get the management, more like business side of like how do you keep this program running, but I also really get the opportunity to interact with the people that we are serving. My team will tell me stories about these women. I'll get to meet them if they come. I if I want to feel like if I want to go to clinic on like a Friday afternoon, I can go. I love that it's a mix of both. And that I'm always connected to the work because my fear in going into healthcare management was being removed from the people that you're serving because you're so bogged down in like the day to day. Um, but I think because I'm so tied to these people, a lot of the women I identify with, a lot of them are Latina. I identify with them in a lot of different ways. I think it just makes me more passionate about the work that I'm doing, and it doesn't really feel like work. And it's stressful at times, and it's hard, and sometimes it's frustrating, but I'm very thankful for that. And it's having the best of both worlds is honestly my favorite part.
And what was the visa process like for you? Because you did say that that was like a consideration coming across the US, being on a student visa, and now probably having to get a work visa to work full time.
Yeah. I it's stressful in I think in any it's always you never know because like your outcome is not in your hands, it's in the hands of other people a lot of the times. I think I'm also recognize that I come from a privileged perspective because I'm Canadian. And the relations with the US, there's a lot of exceptions for Canadians, so I didn't actually have to go through the process of applying for a formal visa. I just had to really apply, and I'm technically on a visa, but I didn't have to go through like the interview process and all of that. It was pretty seamless. Um, my ability to stay is also now tied to my work, or I'm like, I guess international students would understand. I'm on OPT right now, but that's only a year because it's not a STEM OPT. So I had to apply and for a work visa, and this also comes back to being strategic where you get a job. There's just certain like that's why job hunting as an international student is very difficult because you got to be straight up with I will need sponsorship in the future. And some people are like yes, some people are no. So it kind of narrows down your pool. But my program director in the division of women's health was very they're so great and they were like we really want you to stay and so we're going to sponsor you to get your work visa. So I actually got my H1B visa last week, so that kicks in the new year, so I can officially say I'll be here for a little bit longer if everything goes well. But um it's hard being like trying to find a job and it's difficult, but I think it's just getting connected with the right people and just being really upfront with your intentions. You're like, I will need sponsorship. And if they say no, then that's okay. And then you can find another place. But it's just not getting discouraged.
Yeah, thank you for sharing that, and congrats on getting the H1B
Yeah.
H1 visa.
Thank you.
Yeah, yeah, you're most welcome. And I think like going back to like the last sentiment of your thing, there's like let people know your goals, express your intentions of growth, and like see how people react to that,
Yeah.
and take that as a signal of if someone is going to be supportive of your career growth and be a good manager or supervisor or whatever the case might be. That is a great insight. So before I move you on to the Furious Five,
Hmm.
I have two questions, but I combine them as one. So, so
Hmm.
one question. So the question is, where would you like to see yourself in the future, and where can people connect with you?
Yeah. I ideally, I don't know, this might change, but I think I would like to run, I like the hospital setting. I would like to run like a department within a hospital or like something kind of continue to move my way up. I really love maternal and child health. It's something that I'm passionate about. And so I would like to stay there in that field. But you never know. I think my journey has just taught me you never know where you're going to end up, which I feel like is a lot of people's trajectory. But that's where I would like to go, like maybe become a program director or a department administrator in the future. And where you can find me on LinkedIn. Really search up Fernanda Ortega and maybe add like Brigham and Women's Hospital. I'll pop up. I will always down to connect with people, to share, to honestly be of any help that I can be. So feel free to connect with me on there.
Awesome. And we look forward to seeing where your career takes you and wish you many successes in that journey.
Thank you.
You're most welcome. Moving you on to the Furious Five, the five questions I ask all guests. Number one, what advice would you give to a student trying to pursue a career in public health?
Yeah. If there's any theme that you've taken away from this podcast, is ask questions. If you're unsure, if you have a little bit of interest in what someone is doing in public health, ask them to talk for like 30 minutes on Zoom and just kind of get insight, gather as much information as you can, see what you envision yourself. Do you envision yourself doing that or not? And just keep asking questions. I think that's very valuable.
Number two, if you were talking to someone wanting to get into your position, what advice would you give them?
I would say position yourself within, like, even if this position that you want to be in is not available, position yourself through connections in like a way that eventually you'll be able to get there. So if you want to work in like maternal child health, but right now there's not a position available there, I would find something that connects to that. And then just keep expressing your interests that this is what I want to eventually be doing. This is what I'm really passionate about. Let people know what you're passionate about. And then when something comes up and a position opens, they'll be like, oh, they'll make the connection. And then that is kind of an entryway for you to go. But people won't be able to recommend you if they don't know what you're interested in.
Very, very true. Number three, what's something you're working on improving in your life right now?
So I'm trying to be more creative. I'm not very artistic. I'm generally more like analytical. And so right now I'm trying to lean into my artistic side, and I got like a paint by numbers kit. So I'm currently trying to improve that. We're starting from zero, but we can only go up from there. So, yeah, it's been fun so far.
Love that. Love that. Number four, professionally, do you recommend anything?
Yes. So there's a podcast that's called The Healthcare Leadership Mindset. It's hosted by Yolanda Gonzalez. She's also a BU alum. She's working as one of the directors at Mass General Hospital right now. She interviews a variety of different people. So highly recommend that if you're into podcasts.
Awesome. I'll definitely put that in the show notes for anyone that is interested. And then number five, last but not least, if there was one piece of advice you'd give to your younger self, what would that be?
I'll tell my younger self to just take it easy a little bit more. I said there's a lot of pressure to excel, to do well, which is great, but sometimes also just have fun, to not forget that it's a process, to enjoy the process too. Like now looking back, I'm like, well, it's worked out for me. And so a lot of the times that I stressed out about things, I wish I would have just had a little bit more fun, taken it not as serious, knowing that it'll work out.
Love that. Love that. Well, thank you so much, Fernanda, for coming on and sharing your story and your insights. I'm very, very glad that we were connected and that you were able to come on and share your story with us.
Thank you. I really appreciate it. Like I mentioned before, this is a great thing that you have going here. So I'm happy to be a part of it.
Yeah, I appreciate that, and look forward to seeing how we can stay connected and maybe collaborate some more in the future.
Yeah, for sure.
Housekeeping items, everyone. Thank you all so much for watching or listening to this. Be sure to subscribe if you have not as yet. Leave a review, hopefully a 5-star review, and share it with a friend. Share it with someone who will get some value from this episode. That really helps show get out to more people. So I appreciate you all. Thank you all once again. Have a good rest of your week. Peace, everyone.